Hi, I'm Amy from Proactive Pelvic Health Center, and if you watched my last video, you'll remember that we talked about Kegels and did a little bit of an introduction to kind of what they're all about. So what I wanted to do today is actually compare Kegels to something called reverse Kegels. So as a bit of a reminder from the last video, a Kegel is a pelvic floor muscle contraction. So that's a squeeze and a lift of the pelvic floor muscles. You can imagine that you're drinking a milkshake through a straw, and we can facilitate this by contracting on a nice strong exhale. Now the reverse Kegel is the opposite. So with a reverse Kegel, we think about relaxing or lengthening the muscles of the pelvic floor on a nice full inhale. So if we think about an entire breath cycle, we would inhale to relax and lengthen the muscles, and then exhale to squeeze and contract the muscles. Now, similar to the pelvic floor contraction or the Kegel, it can be helpful to have some cueing or something to think about to facilitate this. So I like to imagine like a closed up rose flower. And as you inhale, you blossom or gently open the petals, and that's our relaxation or our lengthening of the pelvic floor muscles. Now, from a rehab standpoint, there can be certain cases where clients would benefit more from a Kegel or a reverse Kegel. So for example, if somebody had, a lot of urinary leakage with things like sneezing or coughing, or if they had a lot of heaviness that was kind of indicative of pelvic organ prolapse, they would likely benefit more from Kegels or pelvic floor contractions to really strengthen up the muscles. And then in contrast, if someone is suffering more from pain with intercourse, or if they have a lot of urgency related to urination, they might benefit more from a reverse Kegel or focusing more on relaxing and lengthening the muscles. Now, it definitely is not always that simple, so I recommend seeing a pelvic floor therapist to do a thorough assessment that can help to determine whether you could potentially benefit more from Kegels or reverse Kegels.